Have you got back pain or back and leg pain? My name's Simon and I'm a spinal physio, and in this video I'm going to be talking about something called Cauda Equina Syndrome. It's something that everyone with back and leg pain should know about. It can lead to permanent damage and disability if it doesn't get seen too soon, so watch this video to find out more. Hey there, Simon here from Hogan and Mitchell, and we're going to talk in this video about Cauda Equina Syndrome. Now, Cauda Equina Syndrome means horse's tail syndrome, and it relates to the nerves that hang down in the base of your spine. It is really important that everyone who has back pain or back and leg pain gets asked about this, because if you do have Cauda Equina Syndrome, you need surgery within 24 to 48 hours. Otherwise, it can lead to permanent damage and permanent disability, and you definitely don't want that. Let's find out some more. So one of the roles of your spine is to protect your spinal cord, and the spinal cord runs down your spine and is protected by the bone. The bone wraps around the spinal cord. Now your spinal cord finishes about a hand's width up from about your pants line. And the rest of the nerves hang down like the hairs on a horse's tail. They are still protected by the spine, but it's the nerves, it is not the spinal cord that has already finished above. And what can happen, and it normally happens if you have an enormous disc herniation, although it can happen due to a tumour from a cancer, but what can happen is if you have an enormous disc herniation, it can compress those nerves. Now these are the nerves that supply the muscles in both your bladder, your bowels and your legs. They supply the skin sensation and a whole raft of other things. So the things that I'm going to tell you to look out for all relate to compression of these nerves. It's really important you get asked them, and it's really important you check whether you do or you do not have them. So the first thing to talk about is urinary symptoms. So these are symptoms related to your bladder. Now, you can get a various raft of symptoms. So if we look at the research around it, there are a whole list of symptoms to look out for. So the first one is an inability to empty your bladder. So you're finding it really difficult to empty your bladder. There are other symptoms such as difficulty stopping the flow of your urine, so stopping the flow as you have a wee. There are other symptoms such as leakage, so you're finding that your pants are wet and they are not normally, or you're finding you're having to use pads when you've never used pads before in the past. One of the final urinary symptoms to look out for is not knowing whether your bladder is full or if it's empty. You just can't feel it. Now the second set of symptoms to look out for is related to an area that is termed your saddle area. And what it means is, do you have any numbness or pins and needles in the area of your genital region or your back passage area? And in some people it can be the inner thighs and it can be on the buttocks. So if you have numbness or pins and needles in any of that area, that is definitely one of the things that could indicate that you have Cauda Equina Syndrome. The third thing to look out for is a problem with your bowels. And in essence, what you're looking out for is a loss of control of your sphincter muscle or your bottom muscle. And what you may find is that you're having leakage or you're actually having accidents. And that is definitely something that you should head straight to A&E for if it is a brand new symptom. So the fourth thing to look out for is an inability to gain an erection. And the fifth thing to look out for is a loss of sensation in your genitals during sexual intercourse. And that applies to men and women. So those are the 5 things to look out for within your own body. And if you do have back or back and leg pain and you ever go and see a medical professional, whether it be a doctor, a physio, an osteopath, a chiropractor, whoever it may be, they should always ask you questions around those 5 things to check that you do not have it. Now, if you do have any of those symptoms, it does not mean you will have Cauda Equina Syndrome. But if you do have any of them, it should be looked at urgently by someone in a medical profession. This is not something that a physio or other healthcare professional can massage or crack your back or exercise away. This is something that needs urgent medical attention. If you have any concerns, you head straight to your emergency department or your accident emergency. I've been a physio for nearly 20 years now, and in my whole career I have only ever seen 5 people who have definitely had it. I've sent many more people for investigation for it, but only a very, very, very small percentage of people will ever get Cauda Equina Syndrome. It is a tiny percentage. But the big message within this video, that if you do have any of those symptoms, and if you do have Cauda Equina Syndrome, it needs urgent medical attention. So there you go. I hope I got the message across seriously enough. It is a really serious problem, but it's only in a very small percentage of people. I hope you find this video useful. If you have, like, comment below or ask us any questions. And of course, do us a favour for me and click subscribe over here before you leave. Thanks for watching. I'll see you soon.